Our society is changing. It is much more multicultural than ever before. The age profile is changing as people live longer. Today, there is a much higher percentage of people aged over 65 in our population. The majority of older people in Ireland live at home or with their family. Increasing numbers of older people live in a residential care setting. Residential care can be operated by public, private or voluntary services. It is everybody's right to lead a life free of abuse, regardless of their ethnic or cultural background, religion, political persuasion, gender, sexual orientation, disability or age. Preventing abuse is everyone's responsibility. All older people have a right to be supported to live a meaningful life connected to their family and friends. All of us who have regular contact with older people have an essential role to play in protecting and promoting this right, as well as a good quality of life for older people. The training DVD you are about to watch was filmed using professional actors. No actual patients or staff were filmed in the making of the DVD. The DVD does not set out to portray best practice in relation to personal care, manual handling, or general care giving. The scenes portrayed are based on national and international research on elder abuse. Some scenes can be quite shocking and disturbing. If you feel you may be distressed by the content of this training DVD, please speak with your line manager. Abuse can happen to an older person in their own home, in a daycare centre, in a residential care facility or nursing home, in a hospital, in sheltered accommodation or in boarding out. In all of these settings, harm and abuse can be caused by family members, neighbours, paid healthcare workers or volunteers. Indeed, elder abuse can be caused by anyone. This training programme has been designed to assist all staff working in residential care settings to recognise elder abuse and poor care practices. It will also inform you of the correct actions to take if you discover or suspect elder abuse. All of us working in residential care settings, such as nursing homes and public long-stay facilities, have a duty to provide the best quality of care for older people while respecting the older person's civil rights, privacy and dignity. All staff in a residential care facility, care assistants, nurses, doctors, social workers, therapists and administrative staff should be aware that they can be complicit in elder abuse and poor care practices. This DVD and training manual are designed so that they can be used together as part of a training programme. The problem of elder abuse was highlighted in the 2002 report, Protecting Our Future. International research has shown that increasing numbers of older people experience regular abuse in some form.
Come on, slow coach. It's time to go to the dining room for dinner.
Ouch, that hurts.
In addition to Protecting Our Future, this training DVD aims to support you in meeting the criteria set out under Section 8, the protection standard of the National Quality Standards for Residential Care Settings for Older People in Ireland, as published by HIQA.
I just want to visit my friends.
Sure, you wouldn't have any idea where to find them. Anyway, you have no friends, they're all dead. Come on back.
The report Protecting Our Future defines elder abuse as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person or violates their human or civil rights. In order to understand and identify abuse, all of us need to observe and think broadly,
Just checking your pad.
so we do not overlook or accept situations of abuse as normal.
Put this on now.
That's not my dress.
Go on,
No.
Helen. Come on, put this on now.
Can everyone come in? Slow coach.
It is common for an older person to be experiencing more than one type of abuse at the same time. An act of abuse to an older person may be against the law and may be considered a crime. Abuse is a violation of an individual's human and civil rights by another person.
Okay, eat the food, Anne. Okay, stop pushing it away.
In a residential care setting, an older person may be abused by a partner, spouse, child, relative or friend, a visitor to the residential facility, a health, social care worker or other paid worker, clinical staff, therapists or administrative staff, or by a volunteer worker. Protecting Our Future recognises 6 types of abuse. They are physical abuse, psychological abuse, financial abuse, sexual abuse, neglect, and acts of omission and discrimination. Most elder abuse occurs at home. However, a significant proportion of elder abuse occurs in a residential care setting, out of sight of the general public.
You're not listening, you're not paying attention.
Helen, you fell again yesterday. Now keep this in front of you.
But I'd like to get around the
It's
place.
for your own good.
Caring for older people is a rewarding but sometimes challenging experience. The majority of incidents of abuse occurring in a residential setting are not deliberate, but are a result of poor work practices, lack of proper training, thoughtlessness, ignorance or time pressure.
Mary, I want to go to the toilet.
In a minute, love. Don't worry, you're wearing a pad.
Abuse can be a result of inappropriate care plans for individual patients or neglect. If we witness poor care practices or do not challenge questionable attitudes towards older people, we contribute towards condoning abuse. Only in a minority of cases is elder abuse a deliberate act.
Thank you very much. Me and my sister will be on holiday.
It is important we realise that the signs of abuse described in the following sections of the programme are only indicators that abuse may be happening. Behaviour and injuries of the type we describe may be present for other reasons. Physical abuse is the injury or mistreatment of an older person through the use of physical force or the threat of physical force. Physical abuse can be deliberate or accidental.
You'll have me.
Come on now.
Please, before you finish with me.
I'll hurry up.
It includes over-medication or the withholding of medication, force-feeding, and the inappropriate use of restraints. Physical abuse may be inflicted directly with a fist or a foot or with a weapon such as a belt or a hairbrush or by burning with a cigarette. Rough handling during caregiving is also a form of physical abuse. The abuser may conceal injuries to prevent the abuse being discovered.
Did you have a fall?
No, it's so nasty. Who did it?
It is important that those who are helping older people with personal care take notice of any bruising or other marks in unusual places. Incidents of physical abuse. Many of the routine tasks that carers need to perform can result in a situation where physical abuse can happen. Some residents may react aggressively to being bathed or washed. Staff should anticipate these situations and seek help and have an appropriate care plan in place. There are also dry hygiene products available, which can be used as an alternative to washing or bathing.
Joe, stop it. Do you hear me? Stop with the drama. We're just having a shower. It's not the end of the world.
On occasion, a resident may behave aggressively towards a staff member by striking them, attempting to strike them, or by being verbally abusive. It is important that staff react to this in a sympathetic way and try to calm the older person.
Calm down. It's all right. It's okay, it's okay. It's okay, it's okay.
Inappropriate use of restraints by carers can be a form of physical abuse.
I hate being tied up like this.
Using a recliner chair when a resident does not really need to be restrained in this way.
It's not right.
Also, inappropriate use of lap belts to restrain a resident in a chair or a bed could be seen as physical abuse. The use of bandages as a restraint is not acceptable. Many patients are not at risk of falling out of bed, so using bed rails to restrain them at night may not be appropriate. Refer to your organisation's restraint policy for further information.
Joe, stay in the bed. If I will have to strap you, I will strap you.
Failure by carers to use a hoist to assist a resident from their bed or a chair and using rough handling to lift them is a form of physical abuse. Carers and nursing staff should be properly trained in the correct procedures before using a hoist to lift a resident. Carers must also be aware that being lifted by a hoist can be a frightening experience for an older person.
Come on, Molly.
Some residents may resist or resent being assisted to use the toilet.
Be good, Molly.
I'm okay.
Or staff may use a commode rather than taking them to the toilet. Giving residents their medication can cause problems for staff. Residents should not be coerced into taking medication.
I don't want it.
If you don't take it, you will end up to hospital.
I don't want it. I don't want it.
Take it. Take it. That's it.
Guidelines should be followed when crushing or disguising medication. The older person's family and their GP or medical officer should be informed when an older person is refusing to take their medication.
Bit of concentration maybe. You've nothing else to do all day but sit here and you still manage to spill your yoghurt on yourself. God, you're great crack. Hello, can anyone hear me?
Psychological abuse or emotional abuse is one of the most commonly reported forms of elder abuse.
What are you doing, Liam?
It can be any verbal or non-verbal act that inflicts emotional pain, mental anguish or distress on the older person. This includes making jokes about or teasing the residents because they are confused or because of their physical appearance.
Why are you taking off your shoes and socks? Are you stupid? Are you thick? Are you all thick?
Deliberately excluding and ignoring older people is also a form of psychological abuse.
You are a bunch of lazy, messy slobs.
Psychological abuse can take the form of threatening, bullying, isolating, shouting, blaming or
Are you
blackmailing.
stupid? Look at you. It's pathetic.
Deliberately ignoring an older person or depriving them of basic needs, pleasures or activities is also psychological abuse.
I want to go to the toilet. Doris.
Now, Liam, come with me to your room. You're not watching the TV with the others because you're a troublemaker and a nuisance.
But this is my favourite programme.
Psychological abuse can be difficult to recognise, as there are no physical scars for anyone to see.
Kids are home. Can I have a cup of tea, please?
Psychological abuse is almost always accompanied by another form of abuse, such as physical abuse. Signs of psychological abuse. The victim may feel or appear depressed, withdrawn, frightened, agitated, anxious or aggressive. The older person feels or seems isolated. Unexpected or unexplained changes in the older person's behaviour. Financial abuse includes theft, fraud, forgery and embezzlement. On occasion, people in a position of power may invent stories to coax money from patients.
Listen to my problems, Betty.
Financial abuse is one of the most commonly reported forms of abuse against older people.
It's been very difficult since John left me and the children. It's been one thing after the other, and now I'm behind on my ESB bill again.
I'm happy to help. How much do you need for the ESB bill?
About €100. Don't tell anyone.
Financial abuse does not have to mean large sums of money. A small amount of money taken regularly from an older person can add up to a large sum over a period of time.
Thanks for buying the raffle tickets, Anne. It was a good cause.
But I gave you €50.
No, love. It was only a 20. You're confused.
Abusers often justify financial abuse by thinking that they deserve the money because they are a carer, they have earned it, that it is their rightful inheritance, or by thinking that the older person does not need it.
But you don't need legal forms for that.
Daddy, I told you the law has changed now. You have to sign this form. And then you have to sign the one for the pension because we have to have it paid into your bank account, OK? It's nothing to worry about, just do it, OK?
Are you sure? I never had to sign anything for that before.
There's nothing to worry about, just do it. Who's going to pay for your funeral?
Mary, you're Betty's principal carer.
Yes, John?
She's complaining that money is missing from her handbag.
No, she must have misplaced it. She's left it in her room somewhere. She's very forgetful.
Signs of financial abuse. Lack of money for basics, newspapers, sweets, cigarettes, hairdresser, despite an adequate income. The older person complaining of money or possessions going missing. Reluctance on the part of family, friends, or the person controlling funds to pay for bills, clothes, treatments, or medical expenses. A person's inability to explain what is happening to their income. Unexplained credit card use or withdrawals. Disappearance of bank statements, pension books, or other documents.
Daddy, so you just need to sign it now. So here we go, just sign it there.
Staff in a residential care setting have a responsibility to protect those in their care from financial abuse.
Just there.
Procedures in relation to residents' finances and receipt of gifts from residents should be followed by all staff. In addition, staff should make sure that they follow the correct procedures when reporting suspected financial abuse and ensure that visitors conduct financial transactions with residents in a proper manner.
Thanks, John.
Is there a problem?
I think so. Deirdre Murphy, Dominic O'Brien's daughter, is getting Dominic to fill a bunch of forms. Should I report this?
Yes, you should report it. I'll actually come with you. I was actually about to head up to the line manager myself.
If you are unsure or concerned about any matter concerning a resident's financial affairs, you should report this to your line manager. Sexual abuse. Sexual abuse is forcing an older person to take part in any sexual activity without their consent. Kissing, forced nudity, fondling, touching, particularly the genitals, making the older person fondle someone else's genitals.
That's terrible. You know you've always been my favourite aunt.
Have I? Yes.
Yeah.
Yes.
Well, I thought I was your favourite nephew.
Oh, you are. Yes.
Sexual abuse is a criminal act which may be reported to the Gardaí. Sexual assault, rape, sodomy, sexual harassment all come under the category of sexual abuse.
No.
Just a little.
No.
Forcing an older person to observe sexual acts, showing them pornographic material, or spying on them in the bathroom or bedroom are all considered sexual abuse. Even telling dirty stories if the older person finds them offensive.
Yeah, we're lovely now.
Yes.
Come on, we'll take
Signs of sexual abuse. Pain, itching or injury in the anal, genital or abdominal area.
Much better, yeah.
Torn, stained or bloody underclothing. Bite marks or bruises on breasts, neck or face. Venereal disease or recurring bouts of cystitis. Unexplained problems with catheters. Difficulty sitting or walking due to discomfort in the genital area. The older person's behaviour may change. They may appear depressed, withdrawn from normal activities, or appear agitated, frightened or anxious.
No, no. No, 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 no.
Claire.
Residents will sometimes make sexual advances towards staff or other residents. An older person suffering from dementia may lose their sexual inhibitions and behave in ways that are distressing to both staff and other residents.
Excuse me, Liam. Okay, excuse me, Liam, you have to calm down.
Staff and management should acknowledge these incidents and manage them in line with your protection policy.
And then you can talk to her, but there will be no touching, okay?
Abuse by neglect and acts of omission.
Here's your dinner, Molly. Eat it up.
Neglect is failing to provide for the basic necessities and physical needs of the older person.